I'm from Hyderabad. So I have medical coding experience almost 10 years, 2 months. So next month it will be 10 years, 3 months. So entire career is my in my IPDRG only. So I'm giving CCS training up to like last 1 year onwards. I'm giving training. So that's the reason we joined here, right? So can anyone confirm? Are you able to see my screen?
No, still we are not able.
No?
No, visible. No, it's visible.
No, it's okay, right? Yeah, thank you. So we know this is for CCS certification program. So this is only introduction part I will cover in this today, like what is actually CCS exam look like and what is the portion we need to cover, how its portion pattern, what is the portion I need to take in the sessions. So all those one we'll discuss, and the final in the final slide I will tell you why we have to choose fast code, all those one. Okay. So shall we start quickly? So this is from Fast Code Solutions. So we are here for the CCS certification program, right? So so in today's session, now we will cover all these topics like introduction, what is eligibility for CCS exam, okay? So an exam overview, registration, how to register for examination, course outline. So what are all topics we need to cover? Exam glossary. So glossary means what are all topics we need to cover in order to clear the CCS exam. And finally, why fast code? So let me first introduce, first before going to this slide, no, we are all, I think we are all from the, some people already having medical coding experience. Some people maybe they're waiting for the certification. So after that certification, no, they can start their career, right? So before going to that one, no, like first we need to know what is medical coding. So what is medical coding means? Just we are converting medical record data, okay, transforming some medical records, equipments, and hospital services into some code language, right? So there is a medical coding. So we are transforming medical information into some code language, right? So we have seen, right, Java, Python, all those ones. This is software type of code languages, right? Writing languages. Same thing we have medical diagnosis procedures and some other services and equipments. We have separate type of language that we will call it as medical coding. So in medical coding now we have so many types of certifications. Like if you take two organizations providing medical certification. So first one will be AAPC. So in that now we can see CPC, CIC, like the certifications will be there. Another organization will be AHIMA. So AHIMA providing CCS examination. So CCS certification is providing by the AHIMA organization, AHIMA, right? So, CCS exam specially designed for the professionals experienced in coding, inpatient and outpatient. So many people will get confusion. So whether it is eligible for outpatient or not. Okay. So, but so many facilities know overall having inpatient facility in their hospital setting. They will prefer for the CCS certification, even though patient, even though that particular coder having CPC or any other certification, they prefer to have CCS specialists only. So why that much means based on the demand. So if you go to American Health Universities, all those one, no, they will prefer for the AHIMA coding guidelines and AHIMA rules and regulations. So that's why outsourcing facilities will be there now in India. Okay, so those are preferring for the CCS certificate. In my this one also, like currently we are having one new project. In that also, they are preferring only CCS certified coders. So they're not accepting CPC or any other certification. So the certified coding specialist will be the who are having CCS certificate. We will call it as certified coding specialist. So common one. So create coded data used to hospitals and medical providers to obtain reimbursement from the insurance. This and all how RCM works. So this is a common one. So this is the introduction part. What is CCS? Overall, what organization giving the CCS certification? Next, what is the eligibility? So they given 5 criteria actually here. You can see here eligibility requires some credentials, education, and experience. But out of these 5 criteria, right, 5 credentials, hold the RHIA or RHIT certification or CCS credentials. All these 3 members can eligible for the taking of CCS certification. Complete course in all following topics like anatomy physiology, if you have knowledge about the anatomy physiology, or pharmacology, pathophysiology. Pharmacology you can see in the B pharmacy student, or else some people know they will do M pharmacy in pharmacology, and medical terminology. So overall having these topic knowledge, they can take CSS exam. And also apart from these, the people should have intermediate advanced ICD knowledge. So without any ICD or CPD or any other this one, they can't go with CCS certification program. Another criteria, attain a minimum of 2 years of related coding experience. So if you have 2 years of experience either in OP or either in IP, they're also eligible for the CCS exam. Another one is holding CCA credential plus. So this is they're offering another certification, that is CCA. So if you have CCA also, you can write for the CCS exam. So last but not least, hold a coding credentials from another certification or organization plus 1 year of experience. So another organization here we can refer like having APC, having any APC organization certificate like CPC or any other one, plus 1+ years of experience in the medical coding. So these people can take exam for the CCS exam. This is clear, no? But briefly, no, freshers and experience both can take the CCS exam. Uh, in simplif uh, in simplified mode, I'm telling. And overall, having real-time experience also, they can take CCS exam. Okay. And inpatient, outpatient. So overall, having inpatient or outpatient medical coding experience, those candidates also can take CCS exam. Okay. No, exam overview. So while writing any competitive exam or any examination, we should know what is a syllabus. So generally we can say what is the syllabus, what and all topics we need to ask, right? So this is the exam overview, how it look like. So it will be CSS exam will be 4 hours test. So we can complete within 1 hour or 2 hours, 3 hours, depends on individual capability. But they given 4 hours timeline. So within this 4 hours, we should complete. It contains like it having 120 to 140 questions. So it depends on the question scenarios. Some people will get 130 questions, some people will get full 136 questions. Okay. So as of now, like the last 2.5 years, they're asking up to 120 to 130 questions only. So why it is varies from the one coder to another coder means there will be some different papers. They're making 4 or 5 types of sections of papers. So if you get any particular this one, there will be some scenarios. So in that scenarios, we can't tell like how many SDX codes will come. if any particular scenario is having more SDX, so they will reduce some multiple billing questions. Okay, so that's why the range will be 120 to 140 questions will be there in CCS exam. The passing score will be like 300 plus marks. If you get 300 also, you can you are eligible, you passed only, or they're preferring 300 plus marks. Actually, overall having 300 score also, they're telling that that particular candidate cleared the exam. Okay. Or other way we can say 80% of total marks. So my organization, or from my organization, one of the coder got 360 score. So previous top score was 358. But anyhow, they want to calculate that score. Just they will consider whether you cleared that exam or not. So exam score is not a benchmark. So whether you cleared the test or not, that is important. Even if you got 301 marks or 360 marks, there will be same preference. There is no like some in CPC exam, no, like someone will get 96%, 97%, but CCS exam, no, they won't prefer like that. If you get 301 marks, also same preference will be there. If you get 360 plus marks, also same preference will be there. Just they will try to, they will find out whether you cleared exam or not. Okay. And examination charge will be $399. So overall having membership, no, it will be $299. Overall doesn't have any membership. The charge will be $399 US. So the exam consists of two sections actually, multiple choice and a medical scenario section. So from the multiple choice, no, it is a computer based test. Just I forgot to tell you, it is a computer based test. One second, guys. Hello, Hina. Yes, Hina. Yes, yes, Hina. I started already. One second, one second. I will tell you. I will share that fresh link. Okay. Yes, just give me 1 second. Hi, Ina, good evening. So just now we started actually. You are in fourth slide. But don't worry, I will share anyhow. I will share this file now. This PPT I will share with you. You can read remaining topics like first slide, just simple uh, decorative slide. Second one is agenda. Third one will be introduction. What is CCS exam? Okay, who are all offering that one? That I covered that topic. Another one is eligibility. Who all can take CCS exam? So anyhow, you are already asking me now whether you can eligible or not. I already told. Same topics I covered here. Okay. So I will continue here after. Just follow with me. Okay. So where we are, the examination cost will be $399 US for the non-members. If you have any membership in Himano, it will be $299. So all exam questions will be multiple choice except scenarios. So coming to the scenarios part now, there will be 8 to 10 scenarios will be there in exam. So no need to lead or no need to write or no need to type any code. They are giving option. So scroll down option will be there. From that scroll down, you need to select. For example, if they given any particular scenario, they will ask question like, what will be the PDX in that particular scenario? So while selecting PDX, now you will get drop down. From that drop down, you need to select what is the PDX. Okay. So I think they will ask from the SDX. Then after they will ask PCS codes. Then after they will ask CPT codes if applies means. Okay, so everything no need to type anything. All are we need to select from already existed code. Clear now this part? No. So billing questions will be there, no? All are multiple choice. So option A, B, C, D. From the options we need to select. Sometimes no, there will be ranges from the billing questions. So previously I told you know, if you get any more SDX or secondary diagnosis, more scenarios will be there, no? So one particular scenario, if you have 10 or 12 SDX means they will reduce some billing questions, some multiple choice questions, but question range will be 120 to 140 in between that range. So it won't be below 120 or it not be greater than 140 questions. And the exam pattern, no, it will cover like inpatient and outpatient, this one medical coding related one, and also some emergency department specialty knowledge they will check in the CCS exam. Also, exam is given in the computer-based format. So across before 2019 and 2019, no, they used to conduct on paper, like physical examination. Now they cancelled that one. You can take only computer-based exam. Okay, so it will be computer-based exam, multiple choice. No need to type anything. You have to select drop-down buttons. Okay, and the question range will be 120 to 140. It's completely 4 hours exam. So if you complete within 4 hours, for example, any particular coder completed within 3 hours, okay, you can walk out. Or you can simply raise your hand and they will tell you like if you are completed means they will send you out. Okay. So coming to the registration part, very simple. Just we can go to the HIMA official page. You can register yourself. And from my side now, I'm doing this one. No need to worry. Sometimes what happens now, especially for Indian users, they will have different type of surname and this one no. If you entered very wrong means it will reflect in the wrong way. So they will reject your examination. So whatever your printed name on the PAN card and Aadhaar card, even with space and uppercase and lowercase, that also they are checking. Okay, so please don't go with own registration. If you know very well means okay, but I'm not advisable that one. Why? Because no, some people after seeing this one, no, they will come to me and they will asking for the do registration like that. So my for your registration now, I will take care of this thing. So coming to the this is the main outline. What is a course outline? Okay, so what and all topics? Okay, what and all questions and what and all pattern range, question range, no, I will cover in this topic. So there are 4 domains actually. So if you take all CCS exam questions now, we can divide into 4 domains. So generally, if you have any medical coding language, medical coding experience now, they will ask now what type of domain knowledge you have, right? So whether you have ED first day experience or ENM experience, ENM IP, OP, or any radiology, pathology, ambulance coding, or inpatient, like that. So many specialties will be there, no? Like, so we have 4 domains in the CCS exam. So first domain will be like coding knowledge and skills, just exclusively for coding language. Okay, so they'll check, they'll give you one straightforward diagnosis. We need to lead the code. Okay, so we need to lead in the ICD-10 book or CPT book, like that will be there. So applying diagnosis or procedure codes based on the provider's documentation in the health record. Okay, so that one. Another one is determine the principal and primary diagnosis and procedure codes, apply coding conventions, guidelines, and regulatory guidelines. So this is a common theme, right? So first you need to lead the code. That is a basic one. Second one, after leading that code, we need to apply our coding conventions, right? So we have 4 sections of coding conventions, right? If you take one PDF file will be there, no? Official reporting and coding, this one, right? So in that you can see 4 sections. Section 1 will be like general coding guidelines, conventions, chapter specific guidelines. Section 2 will be principal diagnosis, selection of principal diagnosis. Section 3 will be Secondly, diagnosis. Section 4 will be outpatient guidelines. So what and all guidelines they will mention in the that official and reporting guidelines file. We need to apply those knowledge in this segment. And another one is applying CPT and HCPCS modifiers to outpatient procedures. Okay, I will also cover this topic, how to lead a particular CPT code or HCPCS or modifiers in the particular scenario. Sequence diagnosis and procedures. Okay, so sequencing of diagnosis, again, we need to review coding conventions. There will be some excludes one, excludes two, or code first, code also, right? There will be so many terms in the conventions, right? We need to apply those knowledge in scenarios actually. Yes, don't mind. Am I audible, right? Is I'm going first? Is everything okay, right? If I'm going fast, just let me know, okay?
Okay.
No means I will continue. Up. And next topic will be like applying present on admission guidelines. So this is exclusively for the inpatient settings. Okay, inpatient. If you are medical, if you are working for the inpatient coders, no, who all don't know how many members are from inpatient coding. They know what is a present on admission guidelines, right? So there will be 5 present on admission. So out of 5, we need to select either one, right? So I never ever given like POAW or U in my entire career, but still their existence will be there. Okay, so that and all I will cover. Address coding edits. So sometimes you will see no solid edit in 3M software, right? So overall having experience in real-time coding now, you can see nosology edits. So when and all where we will get nosology edits, right? So those also they will take. So those type of questions also will be there in the domain 1. Reimbursement classifications. So reimbursement classification now exclusively applying for IPD DRGs. So MSDRG, APR will be there in DRGs, inpatient coding. So it depends on the like it will be in the program of inpatient prospective payment system, IPPS. For reimbursement purpose, now we have 2 types of reimbursement actually. OPPS, outpatient prospective payment system. Another one is inpatient prospective payment system. So don't worry, I will cover all these topics, how it works, how reimbursements generates in different specialties. Okay, so how insurance companies need to pay to hospital side, or else how hospital side they will get money from the insurance companies based on this reimbursement classifications. I will cover that topic also. So abstract patent coordinate data from the health record. So generally, question rises here like what and all documents we need to consider. Sometimes you can see nurse notes. Sometimes you can see radiology reports. So we can't pull all the data in order to give course, right? So what and all medical records we need to consider. So we can't take directly from the laboratory reports. We can't take directly from the X-rays. We can't take directly from the pathology reports, right? So those knowledge also, it will ask in the, it also comes under the domain 1. And another topic they will cover in the domain 1, MCC/CC conditions, major comorbidity conditions and comorbidity condition. So no one asking straightforward questions nowadays. So if you go to 2 years or 3 years back, they will give one specific diagnosis and they will ask like whether it is a CC condition or MCC condition. So after seeing that one, you can go to the tabular list. Okay. So under the tabular list on the right side, you can see whether it is a CC condition or MCC condition. You can easily see, right? So those type of questions will be there. But nowadays, no, they are improvised their little bit toughness. Okay. So instead of that one, no, they are giving one scenario. Okay. So they are giving one scenario. From that scenario, we need to select what is the PDX. We need to find out what and all MCC conditions, what and all CC conditions. Okay. So we should arrange in the sequencing manner. So after arranging sequencing manner, no, they will give 4 options, right? So what option it's correlating, no, we need to select that one. So that like that questions are there nowadays. Okay. So this and all comes under the domain 1. Remember, in this domain, clear about this domain one now. Okay, so there will be probability of 80% chance for the clearing the CCS exam. Okay, so domain one is a very, very important one. I will cover all these topics in sessions. Okay, coming to the domain two. So coding documentation. So now, up to now, we have seen coding part, right? Now they're asking 10.1% will be in the documentation, like um, how to review those documentations and what and all coding or what and all course we need to give from the documents, right? And the medical record discrepancies. Sometimes you can see addendum in the um, medical records. Sometimes you can see late entry in the medical records. Sometimes you can see addendum, late entry. Another one will be there. Queries. Another one I forgot. Late entry, addendum, corrections will be there. Sometimes he can do, physician can do corrections in the medical record. Okay. So what all this comes under the medical record or health record discrepancies. Or sometimes physician can do conflicting documentations. Correct. So if it is any conflicting documentation, then we can go with query. So all these query topics, this addendum or additional information they will add in the health record, right? That comes under the this domain. Okay. Now coming to the third domain, actually, queries. Okay, this is a very, very important topic. They are asking straightforward questions from this domain. So what type of query it is? So how you last query? What is the question format? Okay. So what is the structure and so what is the structure and components of the query? So this will be only, it will take hardly one session. So within one session also it will take hardly one session. From that session, they're asking 4 or 5 questions. So very simple session, very simple section. Okay. So from the last 2.5 years, I'm collecting questions now. Very straightforward questions from this domain. You can easily answer. Just we need to eliminate the wrong options and you will get the right option. Okay. This is a very, very important domain, regulatory compliance. Okay. So also very hectic domain. Why I'm telling hectic domain now? So they're asking HIPAA guidelines. Okay. They're asking billing related questions and they're asking some, you can see here, patient safety indicators. Okay. Payer specific guidelines, integrity of health records, where we need to keep, how we need to keep. Okay. All this information will be there now, like some rules and regulations, government side. Yes, government side, some rules and regulations will be there now before giving their information to other countries. Like anyhow, if we are working in any organization from India, right, that is an outsourcing organization. So we are not directly working through the hospital side. So some CDA people will be there in some companies, I'm saying. So they're hiring CDA people also. So they will work for the direct to the hospital side. But apart from those coders now, all are we are working for the outsourcing companies. So before going to get any particular project now, they will check all these elements, whether we have proper certification, safety certificates from the US government or some organizations will be there, no, they are providing or not. So those certificates, no, they will give based on this guidelines. Right, HIPAA guidelines will be there. HIPAA guideline we know very well, right? So if you go to any organization, there will be one compliance exam. We need to clear that one. So then only they will give some IDs and this one, right? So HIPAA guideline, very well known. Apart from this HIPAA guideline, no, we need to go through every US body regulatory uh, guidelines. So actually, those are not guidelines. Those are laws written by the US government. So before taking any patient data now, before taking any access to patient data, right? You should know aware of what and all things you should not do in the outsourcing company. So you can't access MRN, you can't copy to anywhere outside. Okay, you can't see insurance number without any this one. Like the information will be there, no? That one. So all these guidelines or rules and regulations are laws comes under this domain. So if you see regulator complaints now, it weighing about 29.1%. Okay, so remaining query almost 10%, and demand 2 will be 10%, and coding knowledge that is up to 60%. Okay, so if you know well about the first domain and fourth domain, so you can clear the exam easily. Okay, these are the domains in the CCS exam question pattern. So this is exam glossary. So glossary means generally what and all topics we need to prepare before going to exam now. What and all we need to prepare, what and all topics we need to touch. First, we know ICD guidelines. We should be aware of ICD guidelines. Next, CPT, current procedure terminology. Next, DRGs. So what are all DRGs available? What is a DRG? How it originated? How it works? Okay. And who approved that one? Who developed these DRGs? And what and all? So how many types of DRGs? How it affects factors affecting DRGs? How MS DRG will affect? How API DRG will affect? All those we need to know. Next, APC, ambulatory payment classification. So I told you now, APC actually comes under the OPPS, outpatient prospective payment system. Another topic will be NCCA, National Correct Coding Initiative. So this is also comes under the fourth domain. I told you some rules and regulation. National Correct Coding Initiative. How medical coders should be there, how we need to code in the correct way, like that. There will be some guidelines. We need to discuss that one. Another one is revenue codes. So actually, this is a very new to me. They added this topic, this particular topic in this after this April, May onwards. They added this topic. Previous papers, no. Maybe they have questions, but they didn't given heading like this. So revenue codes, we need to go. At least we should have minimum knowledge about the revenue codes. Actually, these are used by the medical billers, I think so. But I know how to locate that code, how it works, how this one I will tell you. This particular topic, they added in this one. Like on May onwards, the paper has been changed, In that paper, they added this topic. E&M codes, evolution and management codes, how it works, what is the modifiers, okay, what is the E&M levels, minor, moderate, severe will be there, those one, level 1, level 2, like will be there, that one. Complaints. So HIPAA guidelines, all those one comes under the complaints. HIPAA guidelines, CCI. So we have seen National Correct Coding Initiative, right? This is Correct Coding Initiative. Both are same only. Previously, they given Correct Coding Initiative. Now they changed the topic name to National Correct Coding Initiative. That is the difference. Encoder. So encoder is nothing but what and all software available for the coding purpose. We know we have hardly, I think, so many people are aware of 3M software, right? So some people, they know Optum software. So both are used for the leading the code for CPT or PCS or other one. But we know about the Codify. You can see in the APC side, right? So another one software will be there, Epic EU Coder. So in the Epic, actually Epic acquired 3M software. Epic itself developed one coding software. Okay, so they mention it as Epic EU. Some Epica, Epic EU, like that pronunciation will be there. That one. That is also one type of encoder only. Okay, so we should know about this now. So they are not asking direct questions, but somewhere in the multiple choice now we'll get these type of questions. So query, ultimately we should know about the query process, what are the types of queries, when you should query, what is the format and structure of query, what and all this one. So any query now, minimum it should have some characteristics, right? We should know that one. Another one is sequencing. Actually, sequencing we should apply on the second or third topic. Okay. So these are all topics, guys, we should know before taking any CCS exam. So I will cover all these topics. Okay. No need to worry about any other topics. Now, so this is the last part. Why fast code? Right. So I won't tell why fast code. Why? Because after taking exam now, you people will tell to your colleagues and friends why fast code. Okay. So, but as of now, I'll tell you two simple reasons. One, it's not a commercial coding institute. Okay. Another one is success rate. So in my overall taking this CCS exam now, 100% clearance. So if any topic extends 1 hour means, okay, if people are exhausted means I will complete, I will try to complete within 1 hour. If any particular topic will be there, no, sometimes